Sorry.
Brilliant. So my name is Rihanna. I'm a community pediatrician in Yorkshire, in West Yorkshire, and I'm the co-chair of Child Health Advocate for Palestine. We are a grassroots coalition of pediatrician and child health allies who were formed last May 2024. And we have been building up a network of solidarity among pediatrician and child health allies and doing some advocacy work, but mainly pressuring the health institutions, including our own Royal College of Pediatrics and Child Health, to do more, to take more of a stance on the situation and try whatever in its power to put pressure on the UK government and other organizations to do more to alleviate the suffering of children, Gaza's children. So we advocate for their health, for their right to live, and for dignity and justice for their suffering. We have done a few things here and there, including working with the MPs, signing up petitions and delivering it to number 10, as well as mainly working with lobbying with our own Royal College president and members of the board to get them a bit more active in the situation and to see what we can achieve. That is an ongoing collaboration, and hopefully we will but yes, it's an honor to have Project Pure Hope, Omar Dean and Yasser Arain here from Heal Palestine, and really looking forward to it. It's going to be an amazing webinar tonight. Thank you so much.
So, yeah, thank you so much, Ryan. I'm going to tell you a bit more about ICHG at the end. So we can just concentrate on our two speakers that are very kindly given us their time. So we're going to have the two talks initially. So I ask anyone who is joining to please mute themselves. This webinar is going to be recorded. So if you are not comfortable with your face or your name to be shared, please anonymize yourself. And if you have any questions for our speakers while they're talking, please pop them on the chat. I will keep an eye, Ryan and I will keep an eye on that. And at the end, we're going to have a Q&A section where you can just raise your hand and ask your question directly, but we will also go through the questions that have been posted in the chat. Also, if you have any technical issues, again, put in the chat and we'll try our best to help you. So without further ado, I think we can just start, and as people keep dropping in, they can just really join in where we are. So Rihanna, if you want to introduce someone. Thank you.
Thank you. Thanks, Maria. So Dr. Omar Dean is the co-founder of Project Pure Hope, who's joining us tonight. Professionally, he's a healthcare executive in NHS primary care, and he also holds a research and academic roles in some renowned institution. We first heard of their amazing work when they managed to evacuate two children out of Gaza who were in desperate need for medical care into the UK. And that's how they made it into the news. So I'm really grateful that we had the opportunity to hear about their amazing work and how they managed to achieve that. And I'm sure there's a lot more we can learn from all their efforts. Thank you, Omar. All yours.
Thank you very much, Rihanna. Can I just check you can hear me clearly? Is that okay?
Yes, perfect. Thank you.
Perfect. Well, firstly, thank you very much to both of you for your kind introduction and for facilitating us being here. So as Rihanna said, my name is Omar, and together with a few friends, most of us work in healthcare or have roles in humanitarian work, and one of our colleagues is a lawyer. So, you know, we just really wanted to try to do something to support the most vulnerable, which are the injured children in Gaza, in a way in which we could, using the privilege that we have in this country. And if we go way back to sort of November 23, the mission that we set out with was to help injured children, irrespective of any factors, religion, background, anything. If we could help them with medical treatment in this country, that was our core aim, because we know we have some of the best pediatric care in the world in the UK, but some of the best specialists and centres in the UK. And so that's the kind of mission and vision that we set out with. And of course, we met many challenges along the way. But if I start right back at the beginning, There was a very young child by the name of Luai who was 3 years old, and Fazana, who really inspired us with Project Pure Hope, one of our co-founders, she brought this to all of our attention and said, look, we can help Luai in this country. We can definitely help save his life. And so we started to speak with the British government. At the time, it was still the Conservative government, about the opportunity to bring Luai to the UK, that we had the support of some of the best hospitals here in London in particular, and that we could deliver the treatment that he desperately required. He was suffering from very, very severe burns as a result of wounds from a bomb which fell in his home. And he had lost his parents as well, so he was an orphan child. And Fazana, myself, and others, all of us in the group, you know, most of us have got pretty young kids. So when we looked at Luai, we saw our own children, and we saw no difference, and we just wanted to help. So we were lobbying the government for some time, and sadly, it was taking so long to get any progress that what we found was happening was other governments were stepping in to do things, and the Qatari government, excuse me, took Luai to Qatar, and by that point he had deteriorated quite rapidly. And on December 25th, 2023, we knew he was very close to passing away. And it was to the extent that he was continuously calling for his mother. He didn't know his parents had passed. And we had to put somebody on the line to comfort him as his mother, to play the role of his mother. And all of this was really heartbreaking for all of us, as I'm sure it will be affecting everybody listening to this. So for us, really, we couldn't stop there. You know, we knew we hadn't managed to save Luai, but what had happened was completely unacceptable, and that the UK could definitely deliver the care that would have saved his life otherwise. So we continued our mission, and what we realized we needed was two things broadly. One was the support of leading pediatric centers of excellence across the country, and the second was funds, because we knew that the UK government was not prepared to fund any medical treatment or medical evacuations for children from Gaza coming to the UK. So we set out to achieve both of those things, and we were very privileged to, amongst our network and within our own friends and people we know, develop those relationships with very senior people in some of the top hospitals where pediatric care could be delivered. And we also started to fundraise. If you fast forward 18 months from there, we raised roughly £1.5 million. And that was from the generosity of people in the UK and elsewhere, also in the US and different parts of the world. It's been very interesting to see how many people from across the world have donated, but primarily from the UK and the US, and a few charities in the UK who donated substantial sums because they could see the, well, firstly, they were very generous, but secondly, they could see the work that we were doing, what the impact of it could be, which is to set a precedent that never existed before, which is injured Gazan children to be able to come to the UK for treatment. And actually beyond that, if any child is injured in any conflict, they deserve to have that pathway available to them. So we got to that point sometime later, but in the lead up to that, we were still asking the UK government to allow us to bring a group of children. We then moved on to another family of children who again were orphaned and had lost limbs. And we knew that, again, we could provide them with really, really good treatment here in the UK. So we started again with the mission to try and bring them here. We got some way with the government, but again, it was extremely slow to the extent that if we waited much longer, again, they would have deteriorated much further and much more rapidly. So those children, we supported them to go to the UAE. They had quite a lot of coverage. They were called the Hanouna kids from the Hanouna family. And I'm pleased to say that they've had really good treatment there. A lot of people have been involved in that. We had some involvement in that. But you know, they clearly have been able to get some good treatment. I still believe that in the UK, we could have gone a step further, given our expertise. And then sort of round three, there was another group of children, of 12 children, who we now directly went to the Prime Minister, Secretary of State for Health, the Foreign Secretary and the Home Secretary, and specifically requested their intervention for a medical evacuation, either directly from Gaza or from a neighboring country such as Jordan or Egypt. And again, the movements were very slow. We weren't getting the responses we wanted. So we managed to work with another NGO called Gaza Kinder Relief, and we were able to, with them and another charity called Save a Child, evacuate those children to Italy, and they've had their treatment there. So over the course of the last couple of years, whilst we've been continuously putting as much pressure as we can, and remember, we're healthcare professionals, we're not politicians, we're not people in government, we don't have the level of influence that perhaps is required to make these things happen. But we were able to, thankfully, help some children in different countries, but we weren't going to give up in the UK. Change of government came, and we really put a strong case to the Prime Minister and the various Secretaries of State. And they finally said to us, we give you permission to bring 2 children and their companions. And those are the 2 wonderful girls that we were able to bring to the UK. But the conditions were the same as before. Number one, 100% of this had to be privately funded. Number 2, we had to take care of all of the logistics involved in it. And when I say all of it needs to be privately funded, I'm talking about the accommodation, the actual flights, of transferring them from their original location to the UK, their entire accommodation in the UK, their medical treatment in the private wings of hospitals, not in NHS hospitals. That was another condition, that they could not be treated on the NHS. And if they were treated on the NHS, it would draw NHS rate plus 150%. That's what would happen if they had to access NHS care. They would be liable, and by virtue of that, we would be liable for paying the NHS tariff plus 150% if they accessed any NHS care. So we had to guarantee that that wouldn't happen, provide insurance for them, and so on and so forth, and agree to, at the right time, within the 11-month window that we have of them being here, the 11-month visa that they have, to return them to a place of safety, and to support that process. And just to be clear, the visas that we were able to secure are existing frameworks. This isn't something new. So many of you will know that, particularly from Middle Eastern countries and other parts of the world, when people wish to access private medical treatment in the UK, they simply make an application for a medical visa. A private medical visa, they are issued that within a certain time period, and then they're able to come here, get their treatment, and exit. And there are conditions on them during that time. For example, you can't work, or you can't extend your stay beyond whatever is the limit, and it's usually an 11-month total limit. So that's what we've been issued with. In terms of the support we got from the UK government, yes, we had all of the departments rally around us, like the Department of Health, Foreign Office, Home Office, and so on, to facilitate that work. But the work had to be done by us. And what we did benefit from was an accelerated visa application process. So we submitted everything and paid for everything in exactly the same way anybody else would. But then when it came to that being approved, rather than it taking several weeks, it took a few days. So that we're very grateful for, because it enabled us to move to the next step. Myself and a couple of my colleagues flew out to Cairo, which is where the patients were at the time, and we were able to bring them here in April. We're really pleased to say that Rina, who is the 5-year-old girl, has completed her treatment. She's much better. She's not just suffered physical injuries, which often is what a lot of people see and think is the impact. There's a lot of psychological trauma. Just a few examples. I know the family won't mind us sharing, because they've shared these things openly also. Rina was quite sensitive about other adults being around her and being very close to her or touching her. And I'm really pleased to say, and it really brought us all to tears in the last couple of weeks, seeing her actually having swimming lessons here in the UK, and an instructor holding her and showing her how to swim. And it's been part of her therapy and just a bit of normality whilst being here. So we've been really pleased to be some part of facilitating that. Rama, who's the older girl, she's 12 years old. She's still having her treatment. It's going well, but that's going to take some time. It's a bit more complex for her. And we hope that at the end of her treatment also, she has some time for respite. And it's not just treatment, that's the end, and now it's time to return. We hope to give her a bit of time as well, just have some respite like Lina is managing to have right now. So that's kind of where we've got to so far. These two young girls came, one of them came with a sibling, and they both came with their mothers, their respective mothers. We're now at a point where we've gone back to the government to tell them that for us, this was the beginning. We've funded every single aspect of this. We've done everything you've asked us to do. But importantly for us, you know, and thank you for putting this slide on the screen. What it's showing you is a lot of media coverage that we were very lucky to get from the work that we did, and lucky in the sense that it helped with fundraising. It helped raise the profile of the really, really challenging situations in which these families have gone through to get here. And, you know, their stories are ones which I would really encourage you to read. There's one in particular on the screen, the second one from the left. If you haven't read it, I'd go and read that. They've told in their own words the experience that they were having in Gaza and their journey here to the UK and what it's been like. And I would really encourage people to read that, because there are things which we don't hear in the mainstream media generally. And this is hearing it directly from, you know, the mothers of those children. So, you know, we're now asking the government that we've done this, we've achieved it, we'd like to bring some more children. And there were 3 children we were working on in the past few weeks. Another one of them you may have heard of in the media. His name was Hatem. Hatem's home was bombed and both his parents were killed in that bomb strike. His mother was pregnant, and he was orphaned in that bomb strike, and he suffered 40% burns to his body. Or 40% of his body was burnt, and he was being treated by Victoria Rose at the Nasser hospital. And she contacted us and said, is there a way for us to bring him to the UK? Because we've got some great burns units. We could treat him pretty rapidly and give him a really, really good outcome. So again, we mobilized the hospitals. They were ready within 24 hours. We spoke to the government and they were supportive in words that, yeah, that we're able to facilitate. And they actually said to us that if we're able to get these children to Jordan, then we would be able to do a medical evacuation from there, subject to visa reviews and all of the security checks. And the issue is that, again, as I said at the beginning, we're not diplomats, we're not politicians, we're not the people who can simply go to other governments and say, hey, can you open your borders? But some of my colleagues are absolute superheroes, and they managed to even do that. They managed to even get the Jordanian government to agree to allowing these children to cross the border, and for us to be able to bring them from there to the UK. Unfortunately, because the UK government was taking a lot of time to catch up with the speed at which we were traveling, that didn't happen. Fortunately, the Italian government stepped in, and I think it's a great embarrassment for the UK, realistically, that the Italian government came in and said, well, look, we can take them directly out of Israel, get them to the Ramon airport, we will put them on a flight and we'll take them to Italy, and we will treat them at the cost of the government. So it's not taxpayer funded, it's not funded by a private donations, it was funded directly by the Italian government, the entire mission and their treatment. And they didn't just take these 2 kids, one of which was Hatem, who's a 3-year-old, and there was a 1-year-old called Karam, who we were going to evacuate as well. They took them 2 plus 15 other children, plus 23 companions, all on the 11th of June. And all the whilst we're still talking to the UK government, what's going on? There was a 3rd child who's actually in Cairo, and he's a 15-year-old. He requires facial reconstruction, and we have secured one of the best surgeons in the world to do that work. Some of you may know Professor Awais Jilani, and he's agreed to support us with the treatment of this child. We are hoping to bring him over in the next couple of weeks, and there's less of a challenge with that because he's already outside of Gaza. But our efforts and desire still remains on, we would like to help the acute cases within Gaza because they have the greatest need. And there is no reason why we shouldn't be able to medically evacuate them in the same way that the Italian government has done, the Germans have done, the Romanians have done, and so many other European governments, and the American government has done this too. There's no reason why we shouldn't be able to do the same. So we've put that to the Home Secretary in the past couple of weeks. What we know is a requirement is that they should, in the same way that these other governments have done, waive the need for biometrics and rely on the security assessment of their local partners in Israel. They should do exactly, our request is they should do exactly what their counterparts in Italy, Germany, Romania, and so many other countries have done. And we are still very happy to privately fund the medical treatment, the evacuation, and everything that goes with it, just like we've done for Rama and for Rina and their families. We're happy to do the same. But we're asking the UK government to waive the biometrics and to support us, not with one child, not with two, but with a cohort, so that we can stand and say, at least we did, a reasonable number as the UK, where we're seeing so many of our other European countries stepping up, helping 20, 30, 40, 50, 100 children. Why can't we do this in the UK? That's what we're asking the government right now. And we'll carry on asking them this until we get the answer we're looking for. But in the meanwhile, we know there are children in Egypt who and other neighboring countries who were able to leave Gaza before the borders were closed. And we are able to bring them over in the way in which we did with Rama and Rina. So that's kind of where we are. Before I kind of wrap up and hand over for any questions that anybody wishes to ask, I just say a couple of things that have been really important to us. One has been raising the awareness of the really, really catastrophic situation. And I mean, beyond what we see on social media or here in the media, the actual specific issues that families go through and how the UK can really help and how it should help. I mean, all of the people on this call would want to help. I know that. Anybody we speak to wants to help. People in the NHS want to help, even though the NHS cannot help for reasons that I'm still not really clear on, but they cannot help. So there's no shortage of wanting to help, but I think understanding the severity of the situation is important, because that leads me to the next point, that there are very few countries in the world who can deal with some of those issues, the UK being one of them. Not to say other countries can't treat those issues at all, but I believe that the UK is amongst the best in the world at being able to treat some of these very severe and acute issues. And number three is that in order to do this, because we know the NHS cannot treat them on NHS beds or is not permitted to, it requires private funding. Raise the money that we have, but that money goes quite quickly when you're delivering private care. Despite the very generous support that we have from all of the surgeons who have been involved, have waived their fees. They've been so kind and generous. But there are still so many other fees associated with it, like the hospital bed and the team around them and so on and so forth. So the funds are necessary, because the first question the government asks each time we go back to them with another case is, do you have enough funds? You need to provide us with the evidence of that. And then lastly, it is to have the same exact exertion of effort with the government and any influence that we can have with them to get a clear answer as to why can the UK government not waive the biometric requirement in exactly the same way the Italians, the Germans, the Romanians have. Because if they agree to doing that, there is no reason we couldn't bring 20, 30, 40 children directly from Gaza via Karam Abu Salim and via the Ramon airport directly to the UK in exactly the same way those other countries have. So in summary, that's our request for support, to help us to raise awareness about the severity, that the UK is one of the best places in the world for treatment. Number three is that this needs to be privately funded. We are continuing to fundraise, and we have a 100% donation policy. Myself and my colleagues, we all donate our time 100% as volunteers, and we will always do so. And the charity who is housing our funds is UCLH charity. They don't take any administration fees at all for this. They've been very, very kind to us, and it provides a really good, strong governance structure for the holding of those funds and the deployment of those funds for the specific purposes I've mentioned. And number four is applying as much pressure, I would say, with the UK government to get a clear answer as to, well, it's not so much why can't they, it is that we want you to support us to bring 20, 30, 40 children from Gaza directly to the UK. And you need to waive those biometric requirements, because if you do that, there's no reason. I know for sure that the minute we're able to tell people that this is what we can do, the funds will be raised easily. I have no doubt about that. So the real rate limiter here is a decision by the Home Secretary on waiving those biometric requirements. I'll pause there and hand over for any questions that anybody may have. Thank you. Thanks very much for your attention and your time.
Thank you so much, Omar. It was really great hearing from all the amazing work that you've done, and a lot of food for thought and for action, especially for the people in the UK. I think there was some question in the chat, but if it's okay, I will leave it for the end. So we're gonna hear from Yasser first, and then we're gonna come back to the questions. So I'm just gonna stop sharing. So thank you so much, Yasser, for joining us from the US, from Texas, I believe. So Dr. Lorraine was born and raised in California, and he's a neonatologist practicing in the Dallas-Fort Worth area. He completed medical school in the Oregon Health and Science University, and then residency and fellowship at Stanford University. And as a former Fulbright scholar, he lived in Cairo, Egypt, prior to starting medical school, which sparked his interest in global health. He has been to Palestine on medical missions 3 times in the past year, and 1 time to Gaza and 2 times to the West Bank. He's currently an assistant professor at Texas Christian University and an attending neonatologist at Cook Children's Hospital. Thank you. I'll leave you share your slides and just lead on this. Thank you.
Thank you so much. Okay, let's see if I can send a request to share. Is my screen showing, I suppose?
It's not yet, but I said allow, so do you want to try again?
Let me try again. Okay.
Hopefully it will work. Otherwise, I guess I can share.
Okay, sorry, I have to grant access on my end. Oh, okay, there.
Okay, otherwise I'll get it ready so we can sort it. Do you think it's getting there?
Okay, do you guys see?
Yes, we can see the screen.
Okay.
And I think if there are videos, did you click? There is a thing that says share audio as well. Should be on the top. So you know where it says sharing screen at the top of your screen in the Zoom page. Can you see like a little microphone? It should be green.
Can you hear me? You can hear me.
Yeah, we can hear. Just start and then we can see how it goes. Yeah, that's fine. Thank you.
Okay, share sound. Sorry, there we go. Okay. Oh my gosh.
Sorry, that's a lot of security stuff.
Okay. Can you guys hear me?
Yes, we can definitely hear you and we can see your screen. So all is good.
Okay. Okay, so I'm gonna briefly, hopefully, finish on time, talk about my experiences on my medical missions to Palestine over the past, for the most part, over the past year. I will touch, I will touch upon, my work with Heal Palestine. However, I will just preface this by saying my presentation is more tailored towards my personal experiences, with tying in some of the NGOs that I've worked with. So just to briefly go over a timeline, I went to Gaza in April of 2024. I went to the West Bank in September of 24, East Jerusalem and the West Bank in November. And a couple of weeks ago, me and my colleagues were in Amman trying to get into the West Bank. However, the night that we arrived, Israel bombed Iran, and sort of, the 12 days of war happened subsequently, and we were unable to cross into Palestine because the borders were closed and the airspace was closed. So unfortunately, we weren't able to go. So before I proceed, I do have to state this disclaimer. I'm not an employee of Heal Palestine, nor any other non-governmental organizations, and everything that I'm sharing is really a personal reflection of my experiences and observations. Any opinions that I share are not reflective of any organization that I'm affiliated with as a volunteer or any organization that I'm employed by. So I first want to talk about, my work with Heal Palestine. So Heal Palestine, the HEAL stands for Health, Education, Aid, and Leadership. So those are 4 prongs in which the organization tries to address for the Palestinian population, both in the West Bank and in Gaza. For me personally, I've delved in, not only medical care, but education on the medical front, training other doctors and trainees within the medical field, and also facilitating the acquisition of equipment and, doing an assessment in terms of what equipment is necessary and maybe more beneficial for lower resource settings that really present themselves in both Gaza and the West Bank. So in the top picture is a week-long education series that we did in East Jerusalem. We had great turnout amongst residents, fellows, attending neonatologists and nursing students. And it was me and myself and several colleagues that lectured on various topics within neonatology. We attend rounds, we share our insight. On the bottom left is an occupational therapist who's going over, subtle techniques of feeding an infant. In the center picture at the bottom is the group that I traveled with, including Kathy Woodward, who has a formal affiliation with Heal Palestine and is a wonderful nurse practitioner and educator. And on the bottom right is another fellow neonatologist, Zaina Kublawi, and a couple of the doctors and nurses at Gaza Hospital, and they're going over teaching at the bedside. So that's the gist of what my experience with Heal Palestine has been, and it's been a wonderful experience. They do amazing work. I can attest to that personally. But it begs the question of NGOs like Heal Palestine fill the gaps in the system. That's their purpose, but why do they exist? What is their necessity, and what's the underlying system? And that's something that I wanted to sort of give context to. I know part of this is preaching to the choir, but I think if there's a single person in the audience or that would benefit from hearing this information, I think it's worth it. And as we all know, if it's the West Bank, the system is apartheid. Apartheid is not a term that I throw around lightly. This is something that's been declared by the best and most renowned human rights organizations in the world, including Amnesty International, Human Rights Watch, and even Israeli-based organizations like B'Tselem. In the center picture is the picture of the Kalandia checkpoint that separates East Jerusalem and the rest of the West Bank. It's one of the largest checkpoints that exists in Palestine, and it processes thousands of Palestinians on a daily basis. But how do these checkpoints change the outcomes from a healthcare perspective? This is actually something, despite, I consider myself, pretty well versed in the history of Palestine and its relationship with Israel, but it wasn't something that I really thought about as a clinician until I physically went to the West Bank and saw sort of the processes in action and discussed sort of how it affects the patient care and the physicians that work there. And the first thing that really struck out was like neonatal and pediatric transports to higher level care and how difficult they were, because through those checkpoints, either transportation of babies to a higher level of care or pediatric patients or even adult patients either does not happen, it's delayed significantly, or the patients or the patients suffer complications en route. So for example, just to transfer a baby from a lower level hospital to Magasit Hospital, which is the highest level care NICU in Palestine, you have to go through multiple checkpoints, including Galandia checkpoint. And you can imagine you have an ill-equipped ambulance that is then asked to transport, say, an extremely preterm baby, 24, 25, 26 weeks. It becomes much of an issue because one, the ambulance that you transport the baby in may not have the right color license plate. In other words, it may be a Palestinian-based ambulance. And if that's the case, they're only allowed to travel on certain roads and they're not able to physically pass the checkpoint. So that patient will then have to be taken out of the ambulance, transported to another ambulance. And in the meantime, both vehicles are being inspected by IDF soldiers. It's delaying the transportation, it's delaying care, and it becomes really complicated. The second point that I thought about was like parent visitation. And this is even within the West Bank. If you have a mother and father who live in Bethlehem and for some reason or another give birth in Hebron, it becomes really difficult for them to visit their baby or their patient or their child because of checkpoints that pop up sporadically. And then the third most remarkable point to me is healthcare workers themselves, who maybe say they live in Nablus or a surrounding village. If there's a checkpoint that's manned at the entrance of Nablus, for example, then it becomes really difficult for them to get to work. Sometimes entrances to cities are closed completely. And this is sporadic, it's unpredictable, there's no system to it. And so even while I was in the West Bank for the couple of weeks I was there last year, some of the nurses and doctors had to spend the night in the hospital despite coming off of shift. Some residents weren't able to come into the hospital because the checkpoint was closed, essentially. And so, you know, I asked my friend Luai, who's a clinical educator there, I was like, how do you guys deal with this? And he showed me on WhatsApp that they have a crowdsourced WhatsApp chat that all the Palestinians know about and subscribe to. And that basically is people in real time sharing which checkpoints are open, which ones are closed. And he's like, you know, we're Palestinian, we just adapt. I think that's sort of been the mantra for Palestinians for quite some time. So an organization like Heal Palestine, we have started to help facilitate the resources, planning, and execution of a neonatal transport team, and how that would look to sort of mitigate some of these. Sorry, that's my son in the background. To sort of mitigate these challenges. So this infographic on the left, I wanted to share and compare it to the one on the right. So the one on the right is a neonatal referrals poster that was up in Aliyah Hospital in Hebron, and it talks about the different level NICUs across all of the West Bank, what resources are available at which hospital and which facility, just to facilitate, you know, where you would transport a baby. And so if you just compare it to this infographic on the left that I came across this past Christmas, it was just to put things in perspective of sort of the checkpoint system. It was discussing how Mary would have traveled to Bethlehem from Nazareth to Bethlehem if it occurred in modern day Palestine, and all the checkpoints that she would have to go across. And the question was posed, would she have ever made it? And the same question goes for the babies and the pediatric patients, is will they ever make it to the NICU that can appropriately take care of them? And it's a valid question, because even when I was at Aliyah Hospital, which is a level 2, they were taking care of babies that were 500 grams, born at 24, 25 weeks, and they were completely ill-equipped to do so. So just to put that in context, I know I'm talking to some pediatricians, so I hope this hits, but you know, Aliyah Hospital doesn't have the ability to place in a central line. They don't have the ability to give TPN. So all the nutrition is basically, you know, dextrose with some electrolytes. They also are staffed by a pediatrician who has never done any formal neonatology training. And so there's a huge gap in terms of resources available, both in terms of physical equipment, medicines, but also a knowledge gap. And so organizations like Heal Palestine try to fill those, but at this, you know, until the system is changed, really, you know, there's not going to be a surefire way to mitigate the negative outcomes that happen as a result. So now if we talk about Gaza, the system is not just apartheid. It's a blockade. It's a siege that's been happening for almost 2 decades. And now it's genocide. And that's also a term that I don't throw around lightly. And I want to highlight that genocide has been declared in Gaza by the Lemkin Institute. And for those that don't know, Lemkin Institute is named after and was started by Mr. Lemkin, who is a genocide scholar. He's the one that coined the term genocide. He's also of Jewish heritage. And so for them to come out and say, no, what's happening in Gaza unequivocally is a genocide is very powerful. And I think should empower us to use that term and not to shy away in conversations with our colleagues or when advocating for Palestinian rights. Other organizations that have also declared genocide in Gaza include Center for Constitutional Rights and Amnesty International. So I want to briefly go over my time in Gaza and talk about it. So, you know, the doctors that are currently going to Gaza, the nurses that are going to Gaza, the ones that have been, I can tell you unequivocally, medicine, the practice of medicine was maybe a quarter of what we spent our time on and energy on. The other aspects that went into our time in Gaza included serving as journalists, essentially medical journalists at that, working with the ICC and the ICJ lawyers that are presenting cases of genocide. What does that look like? For us is that sorry, I'm gonna hold on one sec. What that looks like is documenting medical cases that are consistent with potential war crimes. This is all as a result of Israel not allowing any international journalists in, and it also highlights how Palestinian voices are dehumanized, and Palestinian journalists are already billed as someone that cannot be trusted or biased in their coverage, which sort of facilitates this snowball effect of not adequately covering all of the happenings of what's happening in Gaza. And so that burden sort of fell on the medical personnel from the West, because we're the only ones that were really allowed in. So a lot of my work, part of my work was just discussing with human rights lawyers, sharing cases that I came across, documenting whatever they wanted me to document. So I actually learned a lot in terms of that, in terms of, practicing outside of the scope of medicine. And then I want to highlight, as we all know, there's limited aid going in. And what this looks like from a neonatal perspective is increased morbidity and mortality that's totally preventable. In this first picture is a baby that was born at 25 weeks. The mom had a stat C-section after her house was bombed. She lost her entire family. She survived, and her baby survived for a couple of weeks. We named her Fatima. If you just notice, this is a baby that, theoretically should look like the baby on the right, should have had a breathing tube in, should have central lines in, should have appropriate, coverage for the head, appropriate size diaper, appropriate size blood pressure cuff, all of the resources that we have in the West, and even in higher level care centers in developing countries. But none of that existed in Gaza because we had to triage those resources. So this baby, we couldn't waste a breathing tube on this baby because we knew that this baby would not survive, because we didn't have any of the other resources that were available to sustain her life. And, by the miracle of God, we were able to keep her alive for 3 weeks, long enough for her mom to recover and meet her before she ended up passing away. And then on the bottom left, I just want to share, touch upon malnutrition. When I went, this was over a year and a half. This is approaching a year and a half ago. Malnutrition was an issue then. You can only imagine how the situation has been exacerbated. This is a baby that had an ostomy because the baby had a midgut volvulus and ended up needing surgery. The baby is the size of a newborn, was only about 3.5 kilos when I met her at 3 months age post-term. Because she didn't have the right and appropriate formula to allow for absorption of nutrients. And you compare and contrast that to a healthy 3-month-old on the right, and you can, there's a stark difference in terms of how they look. We know about the intentional destruction of hospitals. I can attest to this personally. When I went to Gaza, I went to the Nasser Medical Complex, which is now up and running, although it has been attacked in the past couple of months. But when I went, I was part of the first delegation to visit the hospital after the IDF had occupied it. And I can tell you that, the place was intentionally destroyed. I'm talking about CT scans or MRI scans in which the one chip inside of it that allows it to function was removed. It was very tactical in the way that it was destroyed. And these pictures reflect Al Shifa Hospital that my colleague sent, and you can just see blatant disregard for the neonatal units there, and complete destruction of that entity. Al Shifa was the highest level of care in Gaza, so that's the only place where a baby would undergo therapeutic hypothermia. That's the only place that a baby would have a shot at surviving, severe sepsis or being in hypovolemic shock and things like that. Like, that's where those babies got transported to, and that is no longer in existence or up and running. And then the third thing that I do want to highlight is the intentional targeting of healthcare workers. And this is something that hits home, and I'll talk about that in a little bit, but doctors are absolutely being targeted. Nurses are absolutely being targeted. That a graph on the right shows where they're dying, where they've been attacked by the IDF. And a majority of those attacks have been at home. And Haaretz just published this article, I think today or yesterday, and the title of it is "Medicine Can Be Imported, Doctors Cannot. IDF Killing of Hundreds of Gaza Medical Workers Deepens a Health System Crisis." And I think the number of dead right now is over 1,500. That doesn't include the number of maimed and wounded, or the number that have been subjected to torture, to be quite honest, and being held captive. One such person is my friend Wasim. This is a nurse at Al Shifa Hospital at the time that October 7th happened. His first interaction with the war happened when he was transporting a teenage girl into the hospital, and their ambulance was shelled essentially, and you can see the destruction that happened. He miraculously survived. The driver, I believe, survived, but the girl was killed. That happened in October of 2023, and then Wasim was subsequently held captive by the IDF when they took over Al Shifa. He was bound for 4 to 5 days, he tells me. He showed me scars around his abdomen of where they whipped him. And then he was eventually released. But that was just the beginning of sort of his story. His story is actually pretty remarkable. I want him to sort of share the story in his own words, just to convey sort of the level of depravity that's going on in Gaza.
All right, tell me the story you just said.
In Shifa Hospital, mom take the baby like this, and the Israel go out Shifa Hospital. The baby is crying. The Israel come to the mom and take the baby and killed him. All the people see you there.
And you saw it too? You saw it with your own eyes? You saw it?
Yeah,
directly?
face to face. All the people killed the baby because he's crying. He understand of crying, of the booming, of the war. He understand this baby. But the Israel killed the baby.
So that's one of Wasim's stories that he shared with me. He talks about a baby that was shot just for crying in the midst of the loud sounds that occur with war by an IDF soldier. And this happened, if I recall, it wasn't in the video, but it happened right outside of Al Shifa Hospital when everyone was being told to evacuate. So after I got to Gaza, initially I was in Rafah and Khan Yunis, and I eventually went to Deir al-Bala, where Al-Aqsa Martyrs Hospital is, and they had one of the better functioning NICUs at that time. There were only, I think, 2. And the first time I walked into the unit to start rounds, the doctors or the nurses that were there were like, "Hey, can you please come see this baby?" And I was like, "Sure." And they're like, you have to talk about this baby. You have to see this baby. And the baby was Mustafa. Mustafa was born on April 3rd. He, I'll just actually play the video and sort of I tell the story of what happened actually.
Assalamu alaikum, Mustafa. So right here, this is an entry site for a gunshot wound. On the other side is the exit site. He was shot by a quadcopter controlled by the IDF while breastfeeding with his mother.
So Mustafa was shot in Nusayrat refugee camp while he was breastfeeding with his mom by a quadcopter. And the quadcopter bullets are not as big as sniper bullets. So and you can imagine how malleable an infant's skull is. And so the bullet didn't lodge in his brain and went in and out. And Mustafa was able to survive. His parents asked me, what would his future look like? And obviously I shared that he was likely to have permanent brain damage. The imaging that exists in Gaza currently, they only have capabilities of a CT. All the MRI machines have been destroyed, or the hospital complexes housing them have been destroyed. Most of the CT is here. This shows biparietal hematomas, the filling up of essentially evacuated brain tissue, necrotic brain tissue with fluid, and then multiple other areas of hemorrhages sort of all across the brain, mostly in the parietal and occipital areas. And then, I asked the dad if he could provide documentation for me. Could he put together a document just, showing the bullet fragments, where everything happened? And he did a wonderful job of putting together a document that succinctly told the story of what happened, as well as with multiple eyewitnesses. But I want you to hear directly from Mustafa's mom. So I'll go ahead and share her story right here.
السلام عليكم ورحمة الله وبركاته. أنا أم الطفل الرضيع المصاب مصطفى علي عزمي أبو فريع. ولد بتاريخ 3/4/2024 بعملية قيصرية، وتم إصابته وهو عمره 10 أيام بتاريخ 12/4/2024 ثالث أيام الفطر السعيد يوم الجمعة بعد الساعة 1 ظهرا بينما كنت أصنع الغذاء لأطفالي. كان مصطفى جوعان، وضعته على صدري فإذا بطائرات الاحتلال الغادرة طائر تكواد كفتر يخترق هذا الطلق الغادر رأس مصطفى وهو في حضني، واخترق الوسادة وانخرج بين الخيمة. فنظرت إلى الطفل فإذا به ينزف دما، وأحسست أن دماغه تفشفشت في داخل رأسي، وضغطت على رأسي وصرخت بأعلى صوتي: الحقوني الحقوني، طفل استشهد، طفل يصيب، طفل الحقوني. فأخذوه الناس وأسعفوه بسيارات الإسعاف الدفاع المدني إلى مستشفى العودة، ومن ثم إلى مستشفى الأقصى، والآن هو يعاني من مضاعفات ونزيف في داخل الدماغ وكسر بالجمجم وتشنجات. ما ذنب طفلي هذا خرج من رحم أمي ليلقى كل هذا الألم والمعاناة؟ ما ذنب الطفل هذا يتدمر مستقبلا؟ ما ذنب طفلي أن يتدمر مستقبلا؟ أتمنى من مؤسسات العالم كلها وحقوق الإنسان أن تنظر لابني وتؤمن لي مستقبلا. أتمنى منكم النظر لطفلي وتمام علاجه.
So 2 weeks after I had left Gaza, I got a text message from Mustafa's dad, and he showed me that he sent me this video. He said, "I think Mustafa's seizing. What do I do?" And clearly, he has right-sided tonic-clonic movement. And he subsequently had seizures. Thankfully, they were able to get the seizures under control after multiple hospitalizations. And I, again, cautioned him that this may be a recurrent thing that happens, and that he has a guarded prognosis. So I do want to touch on one other, sort of chance meeting that I had. When I went to Gaza, I crossed through the Rafah border in the Sinai Peninsula. It was still open. It had ended up being taken over and bombed about 4 weeks later. But I saw this burly British guy sitting down in the bus that takes all of us over to the Palestinian side. And when I was there, I saw that he had an empty seat next to him, and I was like, I have to sit next to this guy because he doesn't look like a doctor. He doesn't look like a nurse. I was totally stereotyping, but I wanted to hear his story. So I sat next to him, and so we struck up a conversation, and he says, "Oh, my name's Nick Orr." I was like, "What are you doing here?" And he says, "I'm an EOD specialist." An EOD specialist is somebody that specializes in safely detonating unexploded ordinances. And so he had been in the British military for 20 plus years. And this is, after he left the military, this is what he does. And so he goes with these NGOs to war-torn places and tries to help clear them of explosives. He said that the case of Palestine, this was his second time in Gaza since October 7th, that it was the second worst place that he had been after Mosul, Iraq, just based off of his initial visit. And that Mosul was also completely, carpet bombed. And that during this second visit, he didn't have the tools. Israel wouldn't allow him to bring in the tools to, safely de-arm the unexploded ordinances. So he was sort of handicapped in how effective he could be. And he said, "Hey, I know you're a doctor. I know you're going to the hospital. But I bet you, the way that you can be most effective is if you take my contact information, and if you happen to come across any unexploded ordinances, just let me know, reach out to me." And I said, "Okay, sure." Didn't think it would happen. Lo and behold, on day 4, when I was in day 3, when I was going from European Gaza Hospital to Al-Aqsa Martyrs, we're driving down Salahuddin Road, which is like the major road that goes through those cities. And across on the other side, where the other side of the traffic direction goes, I see this huge bomb, and I take a picture of it, and then I'm like, wait, I got to share this with Nick. What do I do? Opened up my Apple Maps, and thankfully it showed where I was. I took a screenshot and I sent it to him, and he says, "Hey, Yasser, nice to meet you. Great work. That's an MK84 1,000 kilo bomb." And so I let him know where it was. I took a screenshot, and he was like, "I'll get back to you." And I didn't really hear from him until 2 days before I left Gaza. And he hit me up and he said, "I went to the MK84 bomb. I moved it to the roadside. I marked the area. We'll have a scheduled recovery team pick it up. When that is, I cannot say, but for now, the road is open and the locals will leave it alone. Thanks for all your help. All the best. And it hit me at that point that like, that was probably the most impactful thing I did during my time in Gaza. Like, honestly, if that potentially saved some lives, like that was probably my most impactful thing. And then it's really a paradigm shift of like, this is a global health mission in a war-torn area. And what is dangerous is not necessarily, the things, not just what patients come in with in the hospital, but it's sort of, from a public health perspective and preventative medicine, it's things that Nick is doing, in terms of decreasing the risk for environmental risk factors for the public population. Now, the irony of this MK84 bomb is that it is made about 30 minutes from where I am right now, from where I live. That bomb that I come across in Gaza is made in literally the town over. And it really hits home in terms of how much work we all have to do in terms of ending this genocide in Gaza, to be quite honest. Nick finished our text messages by telling me this is the worst situation I've ever seen. It's my fourth war to witness. It will be my last. And I just want to highlight that this was in April of 2024. And that was a long time ago. I can only imagine how much worse it is now. So coming up on the end of my presentation, but I think all of us are wondering, like, what can we do? And I think all of us have thought about this for a long time. And I have to constantly ask myself, what am I willing to risk? What am I willing to give? Just to find a way to be effective. And so I've personally engaged in political advocacy. As Omar mentioned, that's something that we all need to continue to do. I am part of a healthcare coalition of doctors and nurses that have all been to Gaza called Healthcare Workers for Humanity. We're having our first meeting in a couple of weeks to sort of discuss our first in-person meeting to discuss what next action steps we need to take as a group. I think all of us need to continue speaking up, whether that's, in public protests or more effectively, potentially within our academic organizations. I saw that the British Medical Association recently formally cut ties with Israeli academic medical institutions, which I think is a huge step forward, just in terms of ostracizing apartheid and genocide. And then I do want to share this, I think each person that we talk about Gaza with, that we talk about Palestine with, and the injustices that are occurring in our collective responsibility will potentially change the handicap that our own governments are placing upon us as a populace. And that, again, Omar really spoke to the UK system. And, there's this sociological phenomenon called the 3.5% rule, where with nonviolent protests, when you engage 3.5% of the population to buy in to that cause, that's sort of the threshold that causes significant political change. And I think 3.5% is attainable. So I know a lot of times, a lot of us feel dismayed by the lack of change, but I think it's going to take each of us to continuing to reach out to someone that may be neutral or even supporting sort of the genocide in Gaza to change their mind. Will have a long impact. And then for my personal book recommendations, I recommend reading The 100 Years War on Palestine, Ethnic Cleansing of Palestine by Ilan Pappé, and most recently published The Message by Ta-Nehisi Coates. So just quick updates. In February 2025, as Omar referenced, Italy has stepped up. They actually evacuated Mustafa, his mother, and his siblings to Milan, where he's currently getting care, and the mother is seeking asylum. Nurse Wasim was married this past April. He currently volunteers at Nasser Hospital. He sends me videos of his trips to the GHF sites to get flour. They're incredibly dangerous and heartbreaking videos. And then for me personally, I have plans to go back to Gaza this first week of August and the West Bank in the fall or winter. And that concludes my presentation. This is my contact information. I have an Instagram where I publish some of the stories that I've shared here. And then there's the link for Hail Palestine, if you guys are curious to learn more about their work or to donate. All right.
Thank you, Yasser. It's an amazing presentation, and thank you for sharing your eyewitness with us. Very powerful, and thanks for sharing the voices of all those suffering inside Gaza. I think it's really important not to forget that they are not just numbers or statistics, that it's people's lives and people's loved ones have been kind of suffering. And what hit me, one of the videos you showed of the mother, Mustafa's mother, talking, was about when as she was talking, you could hear the drones, and that's what I've seen. I heard quite a bit in every footage that comes out of Gaza, that these poor people are not only being bombed, but just constantly being a drone hovering above them. I can just, even that is haunting quite a bit. But yes, we'll take some questions and I will come to you. I think I will start with a question from myself, as I can see that one of our active members of Health Workers for Palestine members is here today, Dr. Omar Abdelmanan, who is the CEO of Health Workers for Palestine, and who's been advocating for our colleagues back in Gaza and trying to be their voices and try our best to mobilize the troops here in the UK and elsewhere in the world. Obviously, it's become a global movement. So Omar, thanks for joining the webinar. I wanted to start the questions with asking you a question. When Project Pure Hope managed eventually, after a year of lobbying and pressuring the government to bring the 2 patients in, obviously the media was quite excited and they jumped on the news, and it was somehow a bit of a kind of clearing a nicer picture of our new government. But you and along with a few other medics published this article on Middle Eastern Eyes, and you accuse the government of shamefully denying Gaza children the right to evacuate and the right to healthcare in the UK. Do you want to come in and tell us what your observation has been and what your thoughts, and as you've heard Omar Dean's struggles, what is your opinion on this?
Thank you, Rehanna. So just to say, I'm not the CEO of Health Workers Palestine. I'm the founder and president. Amir Nimrawi is our Palestinian CEO, who's been doing incredible work. So the first thing I want to say is, before I answer that, is just to congratulate Omar Din and Farzana Rahman and the whole Project Pure Hope team for what they've been doing. Honestly speaking, they are an example of, and Rehanna, you're also an example of when you put a focus on something very specific and you lobby very hard for a very long time, and the fruits come to benefit you. You benefit the fruits later on. So thank you to Omar and the team for doing that. I've got some observations, and actually, interestingly, so I was just rewinding. I actually met the chief executive officer of Great Ormond Street Hospital, Matt Shaw, very early on in November 2023. Farzana and Omar we'd spoken about the possibility of bringing children across to the UK, and I brought that specific case of Lu'ay directly to him, with images shown to him of his injuries, and he almost fell off his chair. He was completely taken aback by that, and the first thing he did was pick up the phone and call around multiple chief executive officers of other hospitals within the UK, big children's hospitals, and basically started activating a network of hospitals that would be able to take in these children. They wanted to use a model which had been done before for Ukraine. So within weeks of the Ukraine war, the invasion by the Russians in Ukraine, over 20 children had been evacuated to Great Ormond Street for treatment with chemotherapy. And that was done A to Z by government officials in terms of funding, in terms of visas, in terms of every part of it was government money and tax money. It was not privately funded. And that, the hope was we would be able to replicate that, and Project Pure Hope, was born out of that, and that's the work they've been doing. Now, seeing 2 cases come across to the UK, whilst for those children and their families is a lifeline, and is very important. It was and felt like a bit of a slap to the face to many of us who have been advocating for children's rights for years and decades. and those who have been traveling into Gaza, like myself, over the last decade. When you look at the double standards, you look at the treatment that Ukrainian children got compared to Gazan children, it's obvious where the double standards lie. Project Pure Hope had to privately fund both those cases. They've had no support from the government in terms of funding. In fact, the government have made it very difficult in terms of visas and permits being approved. And the fact that only two children have come across that had congenital conditions that were not directly bombed or affected by trauma from the actual war itself, to me, and maybe I'm cynical, but to me felt like what I would class as politically neutral cases, where the government can wash its hands free, say it's done its bit, but bring children who almost don't remind the government of how they are complicit in this. The UK government has been providing arms sales to Israel since a very, very, very long time. I think over 570 million pounds worth of arms sales. 15% of every F-35 jet has parts that are directly coming from UK weapons factories. So we have to remember that the UK is actively complicit in this genocide, and the fact that they chose to not bring the children that their own weapons have basically bombed tells a lot for me. And when you look around, you look at Ireland, you look at Italy, you look at the US, even the numbers of children that were coming across from these countries, it's frankly shameful, and it's embarrassing to be a British citizen and to say that our government has actively blocked children from coming across and continues to do so. I may be very scathing in my critique, but I think many of my colleagues, Dr. Hassan Abu Sitta, Dr. Swiyang, and the other authors of that Middle East high opinion piece felt the same, and we felt very strongly that this is what we would call humanitarianism alibi. So this is fake humanitarianism. This is an attempt to essentially, cover up the war crimes that the UK is effectively complicit in. This country has some of the best children's hospitals in the world. It has some of the most fantastic plastic surgeons, orthopedic surgeons who treat these tens of thousands of children that are waiting there. We're not asking for thousands of children to come across. We're asking for, a handful, a dozen children who are in need of multiple operations, plastic reconstructive work, the sort of work that can be done in Birmingham, it can be done in Great Ormond Street, can be done in Alder Hey, and yet, to this day, only two children have come across, as I said. So, that's my analysis, and I think it doesn't take away from what Omar has been doing, and I know they are lobbying extremely hard, and their work is extremely appreciated, and they must carry on and not sort of stop. But we also must, as a medical community and as clinicians and as pediatricians, start asking our royal colleges, start asking our hospitals, start asking our government, actually in this case, what on earth are you doing? Why are you blocking children from coming across to the UK for treatment? This is shameful. This is the 21st century. You're so-called the free leaders of the Western world, and yet you are applying clear double standards when it comes to brown children versus white, blonde, blue-eyed children from Ukraine.
Thank you, Omar. Valid points made. Yeah, and that is what I think, as a medical society, as a medical community, this is our duty to kind of press for that. And I wondered, obviously, Omar, Dean, you have some amazing NGOs and charities behind you, and I know you've been in and out of the Parliament, lobbying MPs and lobbying the Foreign Minister quite a bit. But how can we support you even further with that call? I was going to thank you, Omar. That's really, thank you for going through this. You always elaborate on it and explain it and open it quite nicely for all of us to hear. I'll bring Tony in. Tony, you can. Yeah, please. Tony is the chair of the Child Health Advocates for Palestine, and some of the work that Omar was mentioning is back of Tony's work, and there's a few of us from the steering committee in this webinar as well, and we have been trying to put pressure on the Royal College of Pediatrics to take more of an active role in this process. But Tony, yes, please come in and
yes,
talk
thank
about it.
you, Rehana, and thank you so much Omar and Yasaf, your extremely moving and powerful testimonies, which really are so important to us. And congratulations on the great work you're doing. And I wanted to really just say to ask, really, particularly Omar, what do you think the role of medical institutions is and should be here? Because we have been shocked that medical institutions so far, that includes colleges, have been complicit in actually not speaking out for whatever reason. And we had a conversation with the president of the RCPCH last week, and I specifically asked him if he would like to write an article, an op-ed for The Guardian, and he was very reluctant to consider doing that. I think we should keep pushing that, because I think the role of publicity here is all important. And if medical professionals come out and get publicity for saying what's happening here, then people will be horrified, because I don't think that enough people know about this. And I think you're quite right, Yasser, that in saying that we need to give publicity to these problems. So I really wanted to ask you what you thought is what's holding these medical institutions back? And do you think that this would be a powerful way of putting pressure on the government if they did speak out?
Oh, Omar, I think you're muted. We can't hear you.
Sorry, can you hear me now?
Yes,
Yeah.
thank
Okay,
you.
now I was just saying thank you very much, Tony, for your very kind words. I'm really lucky. We're really lucky to have such wonderful colleagues around us and the support that we have. And Omar Abdul Manan spoke about Matt Shaw at Gosh, and he's been phenomenal, and others like him have been absolutely tremendous in their support. I think there's a lot of fear, is the first thing I'd say. And when you see some of the backlash for very, very non-controversial things, I wouldn't say I understand, but I can see why some people might be fearful and why institutions may be fearful, because the lobby against anything that may be able to support is very, very vulnerable children. We're not talking about adults here who, accusations can be made against them for being part of this or being part of that. We're talking about children, very, very, very little children. This is a completely non-controversial issue. But unfortunately, institutions and members of the government seem to be fearful when it comes to these children. And I think the time has passed of us feeling concerned about saying that ourselves as well, because it's 100% apparent. There are some good people in some of those institutions and in the government who do want to do the right thing and who are supportive. But what you said, Tony, what Yasser said, what Omar was saying about rallying support and drumming up, that 3.5% statistic or, target as a minimum is really, really insightful. Yasser, I like that, because it doesn't sound like a lot in the end, does it? But if you get to that critical mass, you suddenly have a lot of voices saying exactly the same thing. And we're not saying anything controversial. All we're saying is, I have children. We have so many children in this country. We've accepted so many children from Ukraine, from Iraq, from Syria, from different parts of the world. Myself and my colleagues have been directly involved in delivering care to many of those refugees and children from those countries here in the UK on the NHS. There's absolutely no reason why we shouldn't be able to do so for injured Palestinian children. But even if we get beyond the point of why isn't it done in an equal way, let's get to at least the terms of why is it not done? Why can't we just do it? Despite however we achieve it. For example, if it requires private funding, fine. Let's go with that for now. But there's no reason to not accelerate. There's no reason other than fear. And I think the fear, it was an interesting one. When we first saw news of our work being posted on Sky News and all of these things, when you suddenly start seeing the comments under these things on social media, it's horrifying. It's really horrifying. You're talking about children. And the response to it was scary, actually. because it shows you a voice and a face that we don't recognize, which is anti-small children receiving life-saving treatment or treatment that's going to give them quality of life. I will say one thing, which, you know, we've got a phrase which we use, which is every child deserves hope. And I think what goes along with that is, you know, physical trauma is, of course, important to treat. But all of these children have also suffered a lot of psychological trauma. And that is as a direct result of not just this war or whatever you want to call it that's going on right now, it's also as a result of occupation. And some of the earlier issues are as a result of occupation. So some of the injuries or health issues that we are treating are as a result of occupation. So when you combine all of these things together, you suddenly feel there's no option but to do whatever we can to help. But you can't compute against this fear that is felt by institutions and by members of the government. So I think with a loud enough voice, with enough people saying exactly the same thing, which is, please let's get past the fair point. All we are asking is for children. And what is the difference between these children and those children over there? If we're all pushing for that one message, as Omar said, it took a lot of just saying the same thing again and again and again and again to the same people, and then another set of people in the government changed. I believe that we can achieve this, which is to bring a good number of children to this country. But it has been a real eye-opener that institutions who we, in our professional roles, do have relationships with and work with and have seen the good side of, we've also seen a lot of fear amongst them. And I do hope that they get over that fear sooner rather than later.
Thank you so much, Omar. Yes, I wanted to hear your opinion on this, and also I know we're UK based, and I mean, to be honest, it's absolutely shocking what the UK government is doing. And you know, I'm Italian. The Italian government is really right wing. So I think, I know it shouldn't be political, but how come that they're doing so much and we're doing so little / nothing? I wanted to hear a bit about how is it in the US, because I don't know how the situation is there. I know it's a big place. So if you can give us a bit of an insight, what's the role of medical institutions in the US, and what have you been doing, and what is your advice for us? Thank you.
I might get a little dark, to be quite honest, but when you connect the dots with, this is just my opinion, by the way, but when you connect the dots of you know, fighting these institutions that are keeping Palestinian voices down, that are withholding aid to children, that don't want to shed a light on the humanitarian crisis that's been caused, it really comes down to a common thread amongst our countries in general, which is just overwhelming support for Israel and Israel's ambitions, and that it's painted as being in the best interest for our own country's ambitions. And when the fact of the matter is that it's truly our own citizenry that suffers because of wasteful government spending supporting the most active colonial project that still exists in a post-colonial world is Israel. So I think until we connect the dots and really shed light on sort of the quote unquote empire's support for Israel, it's not really going to hit home with our fellow citizens. And I think that's who we really need to reach out to. That's whose hearts we need to touch is, you know, for me as an American, is my fellow US citizens. And just to put this in context, the tide is starting to change a little bit, but there's so much work to do. And one of the things that sort of sheds light on how it's not in our collective best interest to support a genocide, to support the oppression of Palestinians, is, for example, a small town in Texas called San Marcos, which is a college town. You know, the population is not that big. They are sending $4 million annually of their tax revenue to Israel. And it's like, why is a small Texas town sending so much money to Israel? And it's that's how institutionalized support for Israel is on a governmental level. And so these town folk, at their community, their city council meetings, they put together a proposition to stop that funding, because that $4 million can be used to build more schools, repair roads, obviously for more domestic stuff that is going to be strictly beneficial to the San Marcos residents. And as soon as that proposition was proposed in the city council meeting, there was a huge uproar from higher governmental officials. So not necessarily the citizenry, but the people that are in power, who, the governor, Greg Abbott of Texas, puts out a letter almost immediately afterwards and sent it to everyone and published it on online media. And it specifically said that any city that proposes decreasing funding to Israel out of their tax revenue, or putting together similar propositions of promoting for a ceasefire or boycotting Israel, would have their state government funding withheld from them. So that's one of the ways, like, we have to engage not just at the level of the hospitals and the health system. We have to engage citizenry on just the fundamental basis of why we should not support our government's support for Israel, why it's in our own selfishly not in our own best interest. Because I think for a lot of people, Palestine and the Middle East is still the other, and Palestinians don't look like the typical Western citizen. And so it's going to be hard to overcome this momentous change without making it about the citizenry themselves. Like, that's how I think, and as physicians, who are the only ones that are being, constantly engaging with this on the ground, we have to lead the charge. And that means, stepping out of our comfort zone. Like, we didn't go to medical school to become political activists. We didn't go to medical school to be diplomats, but I think that's the role that we have to play in this. And it's hard. It's hard.
Thank you, Yasser. Yeah, absolutely. Absolutely spot on. And that's what we see in our day-to-day life as healthcare advocates, especially when we put ourselves out there in the public eye. We get a lot of criticism not to turn out in marches or speeches or rallies for Palestine with our healthcare kind of outfit or scrubs. They just don't want us to be out there, to be visible, to be talking against the genocide or the crimes that are happening in Gaza. But it just shows how powerful our presence and our stance on the situation is for all those who are anti-Palestinian and all those Zionists and all our institutions are trying to support this narrative, government narrative, to be in full-on allies of a genocidal government. But that's it. As healthcare worker, we have a duty. We made that Hippocratic oath to do no harm, and it doesn't really stop at the bedside. Do no harm means criticizing and naming and shaming those organizations, those institutions, those policies, those governments that cause harm. So unless we understand where the moral duty and the Hippocratic oath lies, which is about justice, fighting for justice to stop the harm, then we can't really move on with our institutions. So this is something that we have to take out to our colleagues who are not sure, or think that being a good doctor means having your suppressing your own conscience and compassion and aligning yourself with the government, who is unfortunately a supporter of a genocidal regime. And definitely to bring that message out, that silence and complicity. And as you say, in the British Medical Association, that message was heard loud and clear. There was around 600 representative bodies present in the annual conference, and 94% of them voted for pro-Palestine motions. One of them included excluding Israeli Medical Association from World Medical Association body. So just shows that, as you say, the thinking and the ideas behind is shifting, and people are moving, and we need to support that, and we need to use that for good, for supporting works like you do and works that Omar Din is doing, and definitely have further push. We have nothing else to lose here, really. The situation is quite dire right now. Thank you, Esther.
Yeah.
There's no questions I can see. There's a lot of lovely comments and statements made. I don't know if Maria, do you want to read some of them? Or
I'm just gonna share once more just the links to the ICHG and your group, the Child Advocate for Palestine. I think the only thing I wanted to say is that absolutely, I mean, this is what we are about with the International Child Ad Group. We're a subgroup of the Royal College of Pediatrics, but we are quite independent. So we have kind of a lot of leverage on the college, which we've been trying to use together with Rihanna and Tim just to put pressure on the president. And I think sometimes there is some power in fighting from within. So, you know, I think there is a balance to find there as well. So if you're interested in what to do, please have a look and do join. We have an advocacy stream, which is basically a lot of stuff on Gaza at the moment, but also migrant children and any other issues that need advocating for, which is a lot. We have a research stream, and then we have an education stream. And then obviously you can also join the Child Advocates for Palestine. I just wanted to say that I think this is someone in the chat said that as pediatricians, we do advocate for children all the time. And I absolutely agree. I think this is, to me, not even, you know, is part of our role, as it's been said in this webinar. But sometimes it does feel like we're not prepared. As Yassar said, nobody teaches you how to do this. So I would say it's very important to not feel alone. There is a beautiful community of people that want to do good like we want to, and it's okay to, you know, ask for help and feel overwhelmed sometimes and take care of yourself. I think it is important to just find a balance that works and to keep strong, because the battle is going to be long. You know, I'm obviously more junior than many people in this call, but I think it's very good to look up for people that have more experience and ask for support. And, you know, there's no too junior person. We can all have a role and we can all advocate whatever your job, your role, your life is. Your voice is valuable, and whichever way you find to speak up, that's really powerful. I don't know if there's any other comments. I can't see the chat anymore. But if not, I think we can wrap up. As I said, this is going to be recorded. I think I will find a way to send the webinar recording via email to all the people that have signed up. I know quite a few people couldn't make it, but that's okay. I just shared the recording. Feel free to share the recording with your network and with whoever you think may be interested. And I think our speakers will be happy for you to contact them as well. So I will... The emails are included in the webinar, but if you're interested and you can't find their contact, please feel free to ask us as well, and we can help you with that. And thank you again, Yasser, Omar, and everyone for taking your time on this Wednesday evening to join us. Hope you have a good evening. Thank you again for coming.
Thank you, Maria. Thanks again for everyone joining, especially Yasser and Omar. Thank you for your time and your amazing presentation. Keep up the good work, and we will definitely be here to support you. Yes, thanks.
Thank you. Thank you very much.
Thank you so much. Take care.
Bye.